Good evening students, welcome back to our channel Ach'z. So today in this section we are going to discuss about the OET exam review of yesterday 26th October 2024. So many students asked to update this, that's why I am here with the complete review. Starting with the first section, reading. In first set of part A, it was about ALS, amyotrophic lateral sclerosis. Paragraph A includes the definition and type. Paragraph B about the signs, symptoms and diagnostic evaluation. Paragraph C includes non-pharmacological treatment and paragraph D about pharmacological treatment. And in C1 and C2, medication complaints and cancer drug trials. Most of the question was related to writer's opinion and attitudes. And also inference based question. Second set, part A with Wilson's disease. Paragraph A including the definition, paragraph B about the signs and symptoms, paragraph C about the causative factor, inherited defect of the gene, and paragraph D about the treatment and prognosis. C1 and C2 shared decision making and also about the modern medicines. So lexical references and inference type of questions were more. Now coming towards the second module, writing. In the first set of letter, you need to write a letter to emergency medical practitioner. Setting, pediatric OPD, patient name Charles, 14 years old. Family history, parents are divorced and he is staying with mother and have an elder brother. Medical history, allergy, chest infection and cellulitis. Related to the condition, he took an injection and result in redness and swelling. Vital signs varies. High blood pressure, temperature and pulse reported. The patient needs urgent attention and care. So you need to write a letter to the emergency medical practitioners including these all things. That's about the first set of letter. Now we will move towards the second set of letter. So here the letter you need to write to a social worker. The patient is a 22 years old young lady. The patient has distress and anxiety. Medical history include attention deficit hyperactivity disorder. Family history, father dead and mother with multiple sclerosis. The patient need further support and counseling section. So you need to write a letter to the social worker including all the information. So that's about the two different set of writing as in yesterday's test. Now we will move towards the next module, speaking section, and we have 4 different cards available. So we will discuss more about that. So in the first role play card, it was a non-case home visit. The patient already has bronchitis, so need to assess the progress. The patient is currently using an oxygen mask, so now he is switching to nasal cannula. So the patient is concerned about the procedure and the use of cannula. So you need to advise and explain him about the usage and care of this particular cannula and try to comfort him. So that's about the first role play card. Coming towards the second card, the emergency department, patient with the burn in left hand. Ask about the pain and discomfort level, proper assessment and education about the dressing needed for 2 to 3 days in clinical setting itself, and explain non-need antibiotic therapy according to the present non-infected condition, and explain about the scar management and further follow-up visit. So that's about the second set. Now we will move towards the third role play card. So hospital ward, that's the setting. The patient admitted for congestive heart failure. Now the patient has leg and arm edema. Nurse need to ask the patient for the physical assessment because doctor already recommended IV cannulation and diuretic administration. So you need to comfort the patient and ask for the permission for the further assessment and cannulation. And to the last set, community health center. Unknown case, one of the parent concerned about the DPT vaccination, administration and even side effect of that. First you need to ask her about the visit. Then after that, reassurance to the mother and mention the availability of vaccine in community health center and also school health center. Now coming towards the listening, first set was talk with a neurologist and talk with the gastroenterologist. Second with the talk with the neurologist and talk with the rheumatologist. All the best for your results. Thank you for your time.